Gail Giese, Board President for the Florida Mental Health Advocacy Coalition. We are a nonprofit, nonpartisan coalition of organizations that advocate for policy changes to improve the quality of life for those who live with a mental illness and/or substance use disorder in the state of Florida. Today we want to talk about health insurance and how lack of equality between how mental illness is treated and how other illnesses are treated adversely affects us and the people we love. Under the federal parity law, insurers may not discriminate against mental health and substance use disorder patients by limiting the insurance coverage available to them or by requiring them to pay more for the same coverage. But it's up to states to enforce this law. Over the next few minutes, you'll hear from 4 of our members who offer their unique perspectives about health insurance equality. Let's start with the viewpoint of a person with lived experience of mental illness.
My name is Casey Gilbert, and I'm a member of NAMI Jacksonville. 2 years ago, I suffered from a deep depression, and my normal antidepressant wasn't enough to lift me out. So my doctor decided to try Rexulti in conjunction with my current antidepressant. At first, it really helped. The first 30 days were amazing. But when it came time for him to write the prescription, I could never get it filled because my insurance company charged over $300 for a 30-day supply. I called my insurance company to no avail, and then I called Rexulti, but I didn't meet the criteria for financial assistance. I've always been amazed that the federal government has considered my bipolar disorder to be a disability, but yet my insurance company oftentimes considers the treatment elective. I've been unable to afford therapy because my copay is $65. By contrast, my primary care physician, my copay is $5. All of this leads to more stress, more symptoms, and more suffering on me and my wife. And she's the biggest support I have.
Thank you, Casey. Your experience is a story we hear all too often. Next, listen to Carole McLean from NAMI Marion County and Heart of Florida. She provides the perspective from a federally qualified not-for-profit health center that integrates primary and behavioral health care.
I'm Carole McLean. I'm president of the Board of Directors of NAMI Marion and Director of Quality, Risk Management, and Compliance at Heart of Florida Health Center in Ocala. Heart of Florida, like about 93% of federally qualified health centers nationwide, offers behavioral health care fully integrated into the primary care setting. We have licensed clinical social workers who are part of our care teams, and they help our patients who are dealing with a personal or family crisis or diagnosed with a mental or substance use disorder. The research indicates that when primary care and behavioral health services are integrated, the access to care is better. The cost can be lower overall, and the outcomes can be improved. It also helps reduce some of the stigma that unfortunately is still associated with seeking mental health services. We offer sliding fee scales and payment plans so we can make our care as affordable as possible for as many patients as possible. But it's important that our patients who have insurance or Medicaid know that they have parity in coverage. At Heart of Florida, we care for our patients' physical and mental health equally. Insurance should too.
Parity is also needed to make it possible for for-profit medical practices to be able to integrate primary health with behavioral health care. Let's listen to Dr. Shannon Fox Levine, owner of Palm Beach Pediatrics.
Hi, I'm Dr. Shannon Fox Levine. I'm a pediatrician and the owner of Palm Beach Pediatrics, an independently owned practice with 3 locations in Palm Beach County. I currently serve as the president of the Palm Beach Pediatric Society and a council chair for the Florida chapter of the American Academy of Pediatrics. I have a passion for advocating for mental health needs in our community. At Palm Beach Pediatrics, as an NCQA recognized patient-centered medical home, we feel strongly about treating both the mind and body of our patients. We are a unique practice that has developed an integrated mental health program, earning a reputation countywide amongst families, schools, and mental health counselors. With the mental health crisis worsening, it is more important than ever for primary care doctors to be screening children and adolescents for mental health disorders. The American Academy of Pediatrics recommends pediatricians screen for ADHD, anxiety, and depression, with brief screening questionnaires at well child visits throughout childhood and adolescence. However, many pediatricians then ask, "What now?" as they report having little to no training, limited time in their schedules and lack of support staffing, limited referral resources, and overall fragmentation of care with the communication amongst pediatrician, family, and the mental health providers. The Palm Beach Pediatrics mental health model has successfully overcome each of these barriers with additional training for medical providers to diagnose and manage disorders, limiting the need to refer out, pairing dedicated care coordinators with providers for best communication, allowing adequate time in schedules to spend time needed face-to-face, and then now hiring mental health professionals for therapy services. The only barrier we have now is financial. The overall lack of payment for services does not justify the effort for many pediatricians. As a private, independently owned pediatric practice, we have struggled financially to pay the therapist and psychologist, even though we know the care is significantly better than having them seen outside of our integrated environment. We worked hard over the past 2 years to credential our mental health team on our insurance plans, but have still met many roadblocks. We currently employ a psychologist and a psychiatric nurse practitioner who are barely collecting enough in fees to pay their salaries, while the medical providers are able to generate upwards of 4 times their salaries to pay for the overhead. We realize that there is a cost to doing business and choosing to give this high quality care, but we need to be able to pay the salaries and operating expenses of our providers and not lose money for our independently owned practice to justify continuing the program. We are committed to finding a way to make this happen. We have proven our concept works, but we'll need to hire more mental health providers to serve our ever-growing population. Parity for mental health services in primary care facilities is crucial for practices like ours to be able to overcome the cost barrier and to continue to provide this invaluable service to the community.
Lastly, we will hear from a mental health advocate who has lived experience with mental illness and has made it his mission to help people understand how their health insurance works.
Hello there, my name is Benjamin Mcafee and I am a mental health advocate, and I also like teaching people how to understand insurance. Now, what I wanted to talk to you today is about insurance in certain categories and how parity or lack of parity impacts behavioral health. So one thing I wanted to talk about was access to providers. Right now, what we see is that there is a limited number of mental health providers that are in network. So what ends up happening is that it forces many people to go out of network or travel a long way just to have an in-network provider that ends up being more affordable. Another category I wanted to talk about was the non-quantitative treatment limitations. That affects the scope and that also affects the duration of treatment. So let me give you a few examples. One thing is that oftentimes when it comes to the health insurance, they want you to get a prior authorization for certain services and they want you to reauthorize them, and they are getting denied oftentimes with no explanation. Another thing is that they look at is medical necessity. This happened to me. I take medication. And I was told, even though the doctor said that my medicine was medically necessary, they determined that it was too expensive. So they decided to try to put me into a generic drug, but it was denied. Also, they're discharging people before they are stable, even though a doctor may say that the person needs to stay in these facilities, and insurance companies are discharging them. Now, why is this really important? Well, we need to talk about investing in mental health because it is fiscally responsible.
Thanks for watching. Now it's time for you to make your voice heard. Here are 3 things you can do. Number 1, sign up for action alerts with the Florida Mental Health Advocacy Coalition. Number 2, call to report complaints if you were prevented from accessing behavioral health care through your plan. And number 3, contact your elected officials. Let's end discrimination against behavioral health patients. Tell your story.